Hi, welcome. I'm trying to learn interventional cardiology. Today, percutaneous coronary intervention or PCI. And after we've done it, we're going to do wrist training. And if you participate in wrist training, this is at your own risk. And this is not a lecture or information, this is just lucid learning. So I'll take no medical advice from it, whatever we say. PCI is also used in people after other forms of myocardial infarction or unstable angina, where there is a high risk of further events. Okay, the PCI. What was PCI? It's the use of angioplasty for the treatment of obstruction of coronary arteries. A deflated balloon catheter is advanced into the obstructed artery and inflated to relieve narrowing, and then maybe a stent placed in to keep the vein open. And this percutaneous coronary intervention or coronary angioplasty is also used in people after other forms of myocardial infarction and not just a heart attack. Maybe there are differences, or unstable angina, where it is also used, where there is a high risk of further events. I'm trying to remember the whole time what angina was. I can't again. Unstable angina, where there is a high risk of further events. The use of PCI in addition to anti-angina medication in stable angina may reduce the number of patients with angina attacks for up to 3 years following the therapy. But it does not reduce the risk of death, future myocardial infarction, or need for other interventions. Okay, PCI can be done additionally to medicamentation against angina if the people have stable angina, and it maybe reduces the risk of an angina attack for 3 years, but the overall risk of death is not reduced. Further myocardial infarction or need for other interventions are also not reduced. So PCI can be used not only by heart attack, but also by other forms of myocardial infarction, and by unstable angina, and by stable angina it can be used additionally to anti-angina. Now that was PCI coronary angioplasty, what was written here. That is not a complete overview of what it is now. Maybe we should look closer what angioplasty is. I don't really get it. Is that the name for injecting the deflated balloon, pushing it through the catheter, widening the vessel, and then placing a stent? Is that the name for angioplasty? But is it not the name of interventional cardiology? I think which the name interventional cardiology describes. Now, because we have a little bit of fun, time learning, let's read the beginning of the article to interventional cardiology. Interventional cardiology is a branch of cardiology that deals specifically with the catheter-based treatment of structural heart diseases. Andreas Gurunzi is considered the father of interventional cardiology after the development of angioplasty by interventional radiologist Charles Dotter. Many procedures can be performed on the heart by catheterization. This most commonly involves the insertion of a sheath into the femoral artery. So there's a difference between a stent and a sheath, and I don't know what it is. The catheterization most commonly involves the insertion of a sheath into the femoral artery. But in practice, any large peripheral artery or vein, and cannulating the heart under X-ray visualization, most commonly fluoroscopy. The radial artery may also be used for cannulating. This approach offers several advantages, including the accessibility of the artery in most patients, the easy control of bleeding, even in anticoagulation. I forgot to say it also in the last part. This is about internal anatomy, blood system, illnesses, the lethal illnesses, and yes, the blood system and diseases. The easy control of bleeding by the radial artery, even in anticoagulant patients. The enhancement of comfort because patients are capable of sitting up and walking immediately following the procedure, and the near absence of clinically significant sequelae in patients with a normal Allen test. Downsides to the approach include spasms of the artery and pain, inability to use larger catheters needed in some procedures, and more radiation exposure. But in recent times, radial approach is getting popularity due to its patient comfort after procedure. The main advantages of using the interventional cardiology or radiology approach are the avoidance of scars and pain. and long post-operative recovery. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. It involves the extraction of clots from occluded coronary arteries and deployment of stents and balloons through a small hole made in a major artery, which has given it the name pinhole surgery as opposed to keyhole surgery. Let's end with reading the finger to angioplasty and the percutaneous coronary intervention or coronary angioplasty. Angioplasty is an intervention to dilate either arteries or veins. Now here's the disease name here, angina. The thing is angioplasty and there's angina. The word angioplasty was not totally invented. It seems that the word means something. We're keeping eyes and ears open to find out what. Percutaneous coronary intervention or PCI or coronary angioplasty is the use of angioplasty for the treatment of obstruction of coronary arteries as a result of coronary artery disease. A deflated balloon catheter is advanced into the obstructed artery and inflated to relieve the narrowing. Certain devices, such as coronary stents, can be deployed to keep the blood vessel open. Various other procedures can also be performed at the same time. After heart attack, it can be restricted to the culprit vessel, the one whose obstruction or thrombosis is suspected of causing the event, or complete revascularization. Complete revascularization is more efficacious in terms of major adverse cardiac events and all-cause mortality. PCI is also used in people after other forms of myocardial infarction or unstable angina, where there is a high risk of further events. The use of PCI in addition to anti-angina medication in stable angina may reduce the number of patients with angina attacks for up to 3 years following the therapy, but it does not reduce the risk of death, future myocardial infarction, or need for other interventions. If you were here for interventional cardiology, you can go directly to the next video. We will do not Wristtraining. If you participate in Wristtraining, this is a different risk. Go to stance. We stand. We're having the arms and hands from the fist next to us, and we bring the fists down and up. That is the spotlight. Again, down. One last time down. And now again fists, and we bring them to the inside, to the outside. The flashlight. We are having 3 rules. The first rule is that we are stopping immediately as soon as there's pain. The second rule is where we come only as fast as we can cover with a little bit of effort and know the magician flat hands and run to the inside, to the outside. And the third rule is we're not overdoing it. We just want to strengthen to exhaust. That was the last time. And the next exercise. The pain can flip back flat. Hands form to flat hands. And bring them up. And out. And close again. And down the body. And now long arms, flat hands, and bring the flat hands down. And again up. And again down. And again up. That is the T-Rex in the morning. And again down. And again up. We're going on. You can skip this exercise. I'm going to do it too. Legs and odds. We're going on with the cautious big bang. We're placing the fingertips of one hand and skipping it to. Let's make a little back. We're going directly on with yes, the 3 days in the Interventional selector. Maybe we're going to skip it to the fist, and we open and we close. We open it, close. The last time we open it, and we close. And we're doing the bicycle bridge, flat hands, so bending the little knuckles. And we open again, and again, bending. Next exercise, your eyes. I'm going to skip it also. No, yeah, I want to do the exercise. We're bending the fingers at the knuckles and pressing on all four. And we open again. And we open. The other hand, we're bending at the knuckles in. We're bending at the knuckles and we're pressing on all four fingers. And we open again. And the next exercise would be, we're going to skip the next one and the next one. So I think we have actually just the last one. We're only going to do with one, so we're just closing. Back arm with moderate pressure over the middle arm, over the middle part of the lower arm. And the other arm on the other side. Now this was the short and wrist training. I thank you very much and until next time.